Hi, my name is Cooper Kidd and I use they them pronouns. Today, we will be talking about LGBTQ+ identified people and mental health. Mental health is a very important topic to talk about and can also be a hard topic for folks to delve into, so please be kind to yourself and take this slowly if you need to. A caveat. It is important to take the time to note that a lot of statistics about the LGBTQ+ community vary widely because of how data on LGBTQ+ people is collected, and also because not everyone is out or feels comfortable stating certain information about themselves in surveys. Therefore, it is important to keep this in mind as we talk about mental health. Mental health status and disparities. A lot of statistics regarding mental health and the LGBTQ+ community can be jarring for folks, but it is important to talk about them to better bring awareness to the needs of the LGBTQ+ community. According to the Williams Institute, LGBTQ+ identified individuals are more than twice as likely as heterosexual people to have a mental health disorder in their lifetime. LGBTQ+ people are also 2.5 times more likely to experience depression, anxiety, and substance misuse when compared to heterosexual people, according to research done by the Kaiser Family Foundation. And LGBTQ+ people are more likely to have engaged in heavy alcohol intake than non-LGBTQ+ people. Additionally, LGBTQ+ people are at an increased risk of suicidality than non-LGBTQ+ identified people. Why these high numbers? Well, health disparities among LGBTQ+ people are linked to stigma and discrimination. Many LGBTQ+ people have reported experiencing stigma and discrimination when accessing health services, leading some to either delay or forego important and necessary health care. Transgender people have higher rates of poverty and unemployment as well, which can exacerbate some of these health disparities, such as lacking access to medical insurance to pay for health-related services. People who have less social support, such as LGBTQ+ people, in areas without a large LGBTQ+ population, or those who have been rejected by their family, are also at risk of worse mental health outcomes. What can be done about this? Well, some of the things that can help are being competent in LGBTQ+ topics and not furthering anti-LGBTQ+ sentiments. Some of the other videos I created cover how to do this in a more concrete way, such as not misgendering folks and doing your own research. Also knowing of LGBTQ+ competent mental health providers, spaces, and treatment centers. Being LGBTQ+ is not a mental disorder. It is also exceptionally important to note that being LGBTQ+ is not a mental disorder and does not imply any impairment in judgment, stability, reliability, or general or vocational abilities. The end. We've reached the end of this video on LGBTQ+ and mental health. Thank you for joining me. Goodbye.